Hey, Charmaine.
Hey, Grafton.
How's it going?
Good. How are you today?
Good, good.
Good.
This is, we were just talking about how to get the camera set up and everything. We're kind of both new to this video deal.
Yep.
But I wanted to talk to you because you are a biofeedback therapist. So you specialize in the mind-body connection and how to kind of work at that to improve the health of the body through, I guess, techniques that you use to make people aware of what their autonomic nervous system is doing and kind of give them a little insight into what's happening inside of them that they don't always kind of think about
That's
on
right.
a minute-to-minute basis. So you have a background as a physical therapist. You have your master's degree in physical therapy, and you're a health and wellness coach as well.
Yes.
We were talking about like motivational interviewing and how you use that a lot of the time with your patients. So that's something that I think is really interesting. And you also have a bachelor's degree in philosophy.
I do.
So I mean, I sometimes dabble in philosophizing myself.
That's good.
So I think you and I have a lot in common, and sometimes like as a physical therapist, I feel a little bit like a fish out of water because we get into very specific things about like joint mechanics and biomechanics and just arthrokinematics and things like that, where we're trying to help somebody with very specific techniques. But we were talking before the interview before we turned the camera on, about how there's a lot of potential for everybody, and you get a lot of bang for your buck from just talking about, or just like working at those general body function kind of approaches.
That's right.
So biofeedback is really what that is. I mean, it's kind of like working with trying to get an idea of what's going on inside you, like we said, that we don't think about on a minute-to-minute basis, like heart rate, respiratory rate. One thing that I'm measuring for the meditation experiment is heart rate variability. So things like that, like you work with those measurements, and maybe tell me a little bit about that.
Well, you're very correct on all of those things. So biofeedback is a great tool to go a little deeper than just on the surface of what we think we're dealing with. Patients, they sometimes say I'm not stressed, but they do have reactions, or their physiology is saying a different thing, and so they're so accustomed to that low grade stress great experience that they're having, that they don't even realize that they're experiencing low grade stress.
Yeah, that was something that I recognized when I started taking the measurements for this experiment. I looked at like my sleep and my blood pressure. I always felt like I was a pretty healthy person.
Right.
But I mean, I guess I've always kind of had a little bit of high blood pressure, but I haven't measured it in a long time, and I'm pretty hypertensive. Like the last few days where I've taken the measurements, they're like 140 over 85 or 90 for my blood pressure, and I had no idea that my blood pressure is creeping up like that, and then my sleep quality is not nearly as good as I thought it was.
Right.
So yeah, I mean, that's something.
So when these things start to change over time very slowly, we don't necessarily pick up on it right away until it hits a critical mass, and then the next thing we know, we're having a panic attack or heart attack, or some other kind of symptom that our homeostasis is so thrown off by then, and it's been that way for too long. It creates long-term health problems. So biofeedback is a great tool for measuring. It's like looking in your physiological mirror, so to speak. You can see your heart rate, not only your heart rate your heart rate, your respiration rate is what I meant to say. Not only the rate of it, but the quality of your breathing. You can see that represented on a screen. You can see your heart rate represented on a screen. You can see your muscle tension represented on your screen, and your skin conductance and your skin temperature.
What is skin conductance?
Skin conductance is basically how sweaty or wet your fingers are. If you're measuring it on the finger. And you've heard of cold and clammy.
Yeah, I mean, I'm most familiar with that when I'm dating.
Right. So that's a sign of your sympathetic nervous system in high gear. You're nervous.
That makes sense.
Right. So that's something that if you're nervous, you can actually train yourself through biofeedback to lower that.
Oh, that'll be helpful.
Yeah. And so basically,
for my next Bumble date.
That's right. Exactly.
I'll come in and see you.
You just took a breath there, and so we use respiration as the tool to be able to manage some of these physiological changes in our body. So you mentioned heart rate variability, and that is another modality that we look at through biofeedback and train on biofeedback. And basically, heart rate variability is just that. It's how much our heart rate varies from moment to moment, beat by beat variation in our heartbeat. If I was to take your pulse right now, it wouldn't just be 70 beats per minute straight. It's 70 beats per minute on average.
Uh-huh.
So when you look at your heartbeat represented on a graph, it's actually moving up and down with your respiration. At least it should be.
Okay.
Yeah. So when we see that represented on the screen, your heart, say the graph is, showing you starting, for instance, your heartbeat starting at 60. As you breathe in, maybe your heartbeat goes up to 65, 70, 75, maybe 80. And as you exhale, your heart rate goes back down.
Right.
And so,
like if you were to if you were to breathe at the same, or if your heart was to beat at the same rate as it is beating when you're breathing in for a minute straight, you'd have 80 beats in that minute.
Mm-hmm.
But then if it were to beat at the rate that it's beating when you're exhaling, you might only have 50 beats in that minute.
Right.
So the average heart rate is the heart rate over the course of the minute, the average for the whole minute. That's your heart rate. But
Correct.
Your heart rate variability is the difference between that fast point and the slower point, or like I've heard like interbeat interval.
Mm-hmm.
So the interval between beats, like the difference in the interbeat
That's right.
interval.
That's actually correct.
Okay.
And so the way we look at it is basically there's some general guidelines of whether someone's heart rate variability is good or excellent or poor. For a typical adult, we'd like to see the heart rate variability at least 10 beats within a breath, or on average, for one breath. But in younger people, it wouldn't be unusual to see it in 20 breaths, maybe even 30. I've seen people's heart rate variability even above 30 when they're athletic.
Yeah.
So the thing
it declines with age normally, right?
Yes, right. It does decline slightly with age. However, if that older individual is very athletic, their heart rate variability may maintain at a
It might
good
look
level.
like a 30-year-old who's like
It could be.
obese and drinking soda and smoking cigarettes.
Right. One of the things with heart rate variability when I work with my patients is that if I see someone have a low heart rate variability, we can easily associate that with why they're coming to see me. They've had a lifelong full of stress. Perhaps they don't take very good care of themselves. And the biggest thing is that they don't do cardiovascular exercise. Exercise is one of the best things to improve heart rate variability.
Right.
So.
Yeah. So, and then I've heard like you don't want too much heart rate variability because that would be like a cardiac arrhythmia, right? So that can kill you. Right. Let's say you have like 15 beats in 2 seconds, and then you have like no beats for like 6 seconds, then you're in trouble.
Well, that really wouldn't be a regular heart rate anyway. Yeah,
that would be pathological variability,
absolutely,
right? But then normally, if you have higher heart rate variability, that's not pathological. That's a good thing.
That's right.
Okay.
Absolutely. The higher, the better. Within those ranges.
Within the healthy.
Right, expectations.
Yeah.
Yes, right. We're not looking at someone who's just come in, through the ambulance or something like that.
Okay. Well, look at this heart rate variability. This is amazing.
It has
20 beats in 2 seconds, and then 0 beats for 20 seconds.
Right, exactly. That's a whole different ball of wax.
Yeah. Okay, so heart rate variability is something that you use. And
yes.
So skin conductance, some of the other things. So how did you kind of get into doing this, and why did you decide to go this route? What was the potential that you saw in like the biofeedback area to help people?
Well, I was working in a clinic as a physical therapist, and
you were doing like orthopedic stuff, like kind of like I'm doing right now over at Spring Hill. That's how we met. You used to work at Spring Hill. I work at Spring Hill now.
That's right. So orthopedic clinic, but that particular clinic happened to see a lot of patients that had chronic pain,
I'm very familiar with that.
a lot of workers' comp and
complex
cases, motor vehicle accidents, and a lot of patients who've had a lot of trauma. Mm-hmm. And these people...
Emotional, physical...
Yes, right. And they didn't have family support. They didn't feel supported even by their medical community.
So
sometimes.
You thought to yourself, this job sucks, I need to find a new way. No, I'm kidding.
No.
It does take it out of you, but it's a good job.
Yeah, these people coming in were so they couldn't get into their own bodies. You couldn't expect them to follow an exercise program or to follow the regular course of physical therapy. A lot of them, because they were not in their bodies in some ways. They weren't breathing appropriately. They were too vigilant and too tense in their muscles to even adequately do an exercise program. So I just found myself having to deal with that obstacle all the time, and I thought, well, biofeedback might be a way to help people to hear what I'm trying to tell them. I'm saying, hey, relax their shoulders, and they don't know. It's
almost like the concept of that. What we do, in the clinic too. We apply the basic concepts of rehab, which is like start where you can start and then build up. But I'm finding the same thing, which is like why I'm really interested, why I really wanted to talk to you, is because sometimes it's like exercise doesn't even seem like the place to start,
right?
Because they're just so their autonomic nervous system and their body is like so deconditioned or like out of place, not
out of balance,
out of balance,
right?
And so you just need to go even farther back than
that's right.
Like it's a bridge, and start with the stuff that you're starting with.
Right. You have to, and they have to be present, and have a sense of command of their bodies before you can have them doing that. And so when I started doing, I got training in biofeedback, and started teaching people just how to breathe, what the aspects of breathing were, and how that in itself helped people to have a different experience in their body, and to start to recognize what kind of states they were in, because they didn't even know it themselves. They were just coping, getting by. Mm-hmm. And I just thought the technology of biofeedback was so interesting to me and fascinating, and to be able to have that kind of inside look to people's physiology was fascinating to me. And I just ran with it from there, and I've been doing it for about 12 years now.
Awesome.
Yeah. So, and that's all I do now.
Yeah.
Yeah. This is all I do now. So it's really great. And I know, Grafton, you're working on that you mentioned that 14-day meditation.
Yeah.
And I just want to say that mindfulness meditation breathing meditation, all those things are, I mean, this is something that basically everyone should be doing.
Yeah.
And biofeedback, if people can't, have a hard time with that, biofeedback is a great tool to help them get into that, to have that, that information, whether it be their heart rate variability or just the pace of their heart rate, whether it be the tension, muscle tension in their face, or whatever it be, to have that information fed back to them can help improve their meditation skills. It helps them focus better on whatever they choose to be mindful of, whether it be their breathing or
I think something that's a challenge for people when it comes to meditation is like they're sitting there, you got their eyes closed, sitting like this, and you're like, am I doing this right? Like, what am I supposed to be feeling? Like, what's supposed to be happening here? And so, like, well, it's kind of like the concept of we use like a blood pressure. Have you ever used a blood pressure cuff for deep neck flexor training?
Yes.
So, like, you can give somebody a home exercise to do some deep neck flexor training, but the movement is so subtle that a lot of people they're not sure if they're doing it right.
Right.
So if you just, like, tell them, like, yeah, you put a towel behind your neck, and you go like this, they're like, they're pressing their head back.
Right.
They're like moving their arms around. And you're like, okay, well, so you use a blood pressure cuff to try to get the pressure to move, and then it's kind of hard to explain.
Well, but that is biofeedback.
Yeah,
that
is biofeedback.
That's
you're right. I never thought about it as
that's
biofeedback. But that's what it is. So, so then they know that they're doing it right, and then they can go home and do it just with a towel roll without that feedback.
That's right.
And it helps them know, like, be confident that they're doing it right.
Right.
And improve their skill and exercise. So that's basically some of the exercises and the things that you do in here and the techniques that you use help people to improve their skills with meditation and some of the interventions. Meditation is a big intervention for trying to improve the health of your autonomic nervous system and trying to cool things off a little bit and get you paying attention to your emotional health, your psychological health, and your physical health. So I think after kind of running through those processes with you, like the different tools that you use, I can see where that would really help somebody, like, understand if they're doing it right, improve their skills, and all those things that you were mentioning. So
yeah, I think, and eventually, once a person who's involved with biofeedback training, they start to become more aware of the physiological sensations or even the psychological, happenings when they're experiencing all these things. Then eventually the goal is that they don't need biofeedback anymore, that they're able to obtain, get into a good breathing pattern, increase their heart rate variability, release muscle tension, warm their hands, whatever it may be that they're working on, without the biofeedback anymore.
Well, that's something we should talk about for sure. You mentioned warming the hands.
Yes.
So I actually came across some literature on meditation helping with Raynaud syndrome, which is cold hands or cold feet, basically cold extremities due to decreased blood flow. And meditation was able to help with that. And I thought that was really, like, fascinating. So
yeah, well,
sounds like you work with that.
I have. Actually, one of the Raynaud's syndrome is one of the conditions that biofeedback is very successful in treating, actually.
Which is crazy.
Well, because you're changing the diameter of the blood vessels in your cardiovascular system when you're breathing in a certain way.
Yeah, if your sympathetic nervous system is all jacked up, and or maybe your parasympathetic nervous system is suppressed, then you're going to have less vasodilation, right? More vasoconstriction. Is that right?
Yeah, well, it's a little more complicated than that, but basically is if you're going on sympathetic drive, you're stressed out, you're tense, you're in your head and you're not in your body, and you're experiencing chronic pain or marital stress or whatever it is, if you're in more of that sympathetic,
You're on a date.
if you're on a date and sympathetic nervous system overload, what happens when we're in a sympathetic overload, right? We're in the kind of fight or flight. When we're fighting or flighting, all our blood needs to go to our large muscle groups so that we can run.
Mm-hmm.
And so that tends to pull the blood away from the feet and the hands.
Yeah.
So that's in terms of just general, not necessarily Raynaud's. Raynaud's is a little more complex because it's associated with autoimmune disease usually. It causes vasospasms in the fingers, in the fingertips and things like that. Cause the hands to get really cold and blue and sometimes white. It's very painful. So, but when people with Raynaud's syndrome learn how to regulate their breathing, it also regulates their cardiovascular system, opens the blood vessels up, and as the blood goes down into the hands and feet, the hands and feet will warm up. So that's the idea.
Yeah, that's mindfulness meditation. The kind of meditation I'm experimenting with right now is focused on bringing the attention to the breath.
Mm-hmm.
And one of the insights I've kind of had, just with the limited experience I've had so far, is like I was thinking about it, and breath is sort of like an intermediary step between our autonomic nervous system, like heart rate. If we just focus on trying to change our heart rate, you can't really do that.
No.
So but breath, you can change how you breathe.
That's right.
Breath is controlled by the autonomic nervous system, but at the same time, you have some voluntary control over it. So it's kind of like an intermediary, kind of like bridge that you can use to affect. Is that a good way of looking at it? Or?
Well, earlier I said no when you asked me about changing heart rate. That's actually not completely accurate, and I want to correct myself about that. If you are thinking about your problems and ruminating about your problems, that causes an unsmooth heart rate.
Mm-hmm.
Okay, if you are in a calm situation, you're with people you love, you're thinking about things you appreciate, that causes a smooth heart rate. So those situations are irregardless of how you're breathing. If you are feeling good and loved and
now, when you say smooth, what do you mean?
I'm referring to these the correlation between respiration and heart rate.
Oh,
so when we breathe up and down like this, and we see
there's
these
a word for that
peaks
too,
and
right?
valleys, resonance.
Resonance. Yeah, you're talking about resonance.
Right,
okay.
Right.
So smoothness in your heart rate, that means like better resonance between your respiration rate and your heart rate.
Right. Well, and coherence, I guess is the word you're looking for. The coherence is when the heart rate and the respiration are in phase and they're coherent,
Yeah.
And when that's happening, okay, so you could breathe, you could use respiration to get that. But researchers also found, specifically through the heart math people, that just thinking about something you appreciate can do that to your heart also.
Okay.
Just basically speaks to positive emotions and positive thinking.
Right.
And how that changes your physiology.
Yeah, and there's another kind of meditation called gratitude meditation that people use to try to get at that, I guess, a little bit. So that kind of, what you're talking about, I never thought about it that way, but that kind of, I guess, is what the people that are using gratitude meditation are trying to take advantage of.
Absolutely.
Is that mechanism. So that's pretty interesting, actually.
Yeah. And I imagine in those people who do gratitude meditation, not only does it improve perhaps their heart rate respiration coherence and improve their heart rate variability, but it probably changes other things in their physiology. Perhaps it improves their neurotransmitters and certain hormones and other chemical reactions in their body to be more homeostatic.
Robust.
Robust, for healing and well-being.
Yeah, so that there again, that's another area where, like with the breath, you can change your heart rate, but you can't change your heart rate by focusing on your heart rate. Like you're thinking about your breath, right?
I see what you're saying,
and
right.
so like if you're if you're trying to change your heart rate, you can use a couple different bridges to get there. You can use your breath, you can use your thoughts, and kind of like try to be disciplined.
But you can't will your heartbeat to be different.
Yeah, you can't just say, Actually, if you do that, you probably would make it speed up.
That's right.
It's really hard to make it slow down. Like you can't just be like, slow down.
Well,
that's gonna be
the effort.
It's probably just gonna make it worse. Yeah.
Right. That's right. You can't put effort towards anything you're working on with biofeedback.
Yeah, and then like I guess it's the same thing like using the dating example, which I thought was funny that you brought up like running away like right after. It makes you want to run away. Like I've been on dates like that before. Yeah, how do you know about my dating life, Charmaine? Jeez.
You might need some extra biofeedback sessions for that, especially before that special date.
Yeah. So, yeah, I guess just trying to like cool things off, and that can be like a big help for. I don't know where I was going with that.
That's okay. We're talking about the dating thing, but I wanted to point something out.
About dating.
This is a little off the subject, but your sympathetic nervous system reacts that way because you have something to possibly lose before that date. So you think of it that way. It's actually a good sign.
I was thinking about like when, like a blind date that makes you want to run away.
No. Okay. Well, that's a different story. Yeah. That's a different fight or flight situation.
Yeah. But I am a 30-year-old man boy that still gets nervous around women, so.
All right. Well, we'll have to save that one for another time.
Okay. Yeah. Whole different subject. So yeah, gratitude meditation and this connection is that's definitely an interesting one, and a lot of people are like combining mindfulness meditation with gratitude meditation, and that's like I think that's something that could be really valuable too. I mean, I'm just experimenting with just mindfulness meditation, 20 minutes a day for 14 days. But there's so many different ways to approach meditation, and I guess it would be individual. Like,
I think
each individual could benefit from a different kind of approach. A lot of people are doing like 10 minutes of mindfulness and 5 minutes of gratitude at the end.
I wouldn't consider myself a meditation expert. I do teach mindfulness to my clients, and I meditate myself, but I think it doesn't matter what kind of meditation you do, as long as you do something. I mean, it's the same thing with exercise. As long as you get out there and move, you're going to reap the benefits somehow. And it, I guess, depends on your goals as well. But research shows that meditation, and there's different types of meditation, like you said. I'm sure there's different research that's been done on different types of meditation.
Yeah, there is.
And, science is always trying to find the nitty-gritty of what's the best. But I think the take-home message is, if you're mindful about your breathing and you practice some form of quieting your mind and focusing your mind on something very simple like your breathing, that there are health benefits to be had. And whether or not you want to worry about if you're, grateful for things during, I think those types of things may come naturally as you meditate as well. So that's my 2 cents about meditation. I think it's easy to get hung up on different, approaches and things like that.
Yeah, like trying to iron out all the details. Like, you just need to start somewhere.
Right. And people are so fearful. Sometimes the thing that's blocking them is that they feel like they're failing at it. But even the best meditators, minds still wander. I think that's a natural human thing. Mm-hmm. So the meditation is a practice. It's not something that you're all of a sudden just super great at.
Yeah.
It's a practice, and there may be days that you do better than others or it feels better than others, but the idea is to practice to quiet the mind, and that helps. That supposedly can help with physical and psychological well-being, and I say supposedly, I believe it does, but
Yeah, I think, I mean, one of the purposes of what I'm trying to do is, you know, when you say supposedly, I mean, there's hard literature to support that it does help
Right.
For well, I mean, if you look at like a randomized controlled trial kind of design, like the placebo group doesn't do as well as the mindfulness intervention group in a lot of these studies that I've been like citing on the experiment page and stuff like that. But it's more like there will be subjects in the intervention group that do worse than the subjects in the placebo group.
Mm-hmm.
So just because this randomized controlled design showed significant results, significant improvement over placebo with mindfulness meditation and reducing blood pressure, for example, that doesn't mean that everybody is going to experience a reduction in blood pressure.
Right.
I'm hoping I do. I could use it.
Well, there's a lot of variables.
Yeah, there's a lot of variables. And so, like, kind of my approach to this was I want to design a way for people to measure in themselves to see if it actually worked for them.
Mm-hmm.
Because just because there's evidence to support that it works for a lot of people, it doesn't mean it's going to work for you. And then going back to kind of like what you were saying about the different kinds of meditation and people getting caught up in which kind to do, whether or not they're doing it correctly, and the important thing is just to start. I would say that, yeah, that's the important thing, and then also to experiment with as you go. I mean, once you get started, then you can experiment with other kinds of meditation, like gratitude or a combination.
Absolutely. To see which one works the best, and one of them may click with someone that helps them more.
Yeah, and you could do, I mean, there's a variety of ways you could you could take some of the measurements that I'm taking for the experiment and then try mindfulness and then try gratitude later and see if gratitude works better than mindfulness for you, or transcendental works better than mindfulness, all these different kinds. You could do it that way, or you could just simply try it and see how you feel after mindfulness and then see how you feel after gratitude. That's a measurement as well. It's like subjective experience measurement.
Absolutely. And it equals you.
And equals you.
That's right.
Thanks for the, what do you call that? You dropped a little promotion in there.
There you go.
So a plug.
A plug, yeah. That's right.
Plug for and equals you. So maybe it would be helpful. I think that's maybe a good explanation of kind of biofeedback and your thoughts on it and meditation and whatnot. Maybe we could kind of show what some of the things that you work with, and
sure,
maybe I could be your experiment for that and your test subject or whatever.
Certainly. Let's do that.
All right.
Okay, good.
Hey, I'm here with Charmaine.
Hello.
And she's got me hooked up to some biofeedback equipment. So she's going to kind of demonstrate on me some of the methods that she uses that we were talking about earlier to try to improve people's health through these different measurements that she's taking. So I got my respiration band, right?
Yep.
This is the respiration band, and this is a little heart rate measurement device, and this is a temperature measurement.
That's right. So right now we've got a screen up that shows Grafton's respiration through that respiration belt that he has around his diaphragm muscle. And I'm going to ask Grafton, go ahead and just breathe like you do when you practice your meditation. And we'll just get a sense of what his breathing looks like when he is practicing mindful breath meditation. And you can see as he inhales, the line graph goes up, and as he exhales, the line graph goes down. And we look to see if those breaths are even, if they're smooth, or if they're jaggedy, And we also look at the rate of his respiration. Right now, his breath rate is hovering around a little bit less than 5 breaths per minute, which is a great meditation speed of breathing.
It's Buddha breathing right there.
Buddha breathing, that's great Buddha breathing. So one of the things we look at before we get to heart rate variability training, we want to look at his heart rate and respiration coherence. And what that means is how well is his heart rate beating in relationship to his respiration. So we're going to look at that right now.
Uh-oh.
And I get the screen over there.
This is where I had trouble last time I was here.
So this screen also, I'll orient you. The main screen with the red and blue line graphs, the blue is his respiration. The red is his heartbeat, and it's meant to be squared like that because our heartbeat is not continuous. It's ba-bump, ba-bump, ba-bump. But you can see as he takes slow, smooth breaths, his heartbeat follows along right with him. So that is called respiration and heart rate coherence. And you'll see the magenta bar on the far edge of the screen gives us the percentage of coherence, and he's at like 85% coherence, which is excellent. Anything at 75% or more is great, just really good. The turquoise line that you see is a pacer. That pacer I can set to any speed of training. So if his respiration, if he likes to breathe around 4.5 breaths per minute, I can set that pacer at 4.5 breaths and see how he does with that. Everyone has something called a resonant frequency of breathing, and that is sort of like someone's own fingerprint of breathing, where their heart rate and their respiration are optimal and most coherent. And when we practice breathing resonance frequency at that speed, that is when we're going to get the most health benefits for cardiovascular benefits and nervous system benefits. So I'm going to, his resonant frequency could be anywhere between 4.5 to 6.5 breaths per minute. So Grafton, I'm going to have you follow that turquoise line or bar graph. You're going to inhale when the bar goes up, and you're going to exhale when the bar goes down. If you're done inhaling by the time before the bar reaches the top, then just pause, hold your breath, and wait for the bar to descend again before you exhale. Same thing, if you are done exhaling before bar is down there, hold your breath or just pause and wait for the bar so that you can go up and down in phase with the pacer. So right now I have him set at 5 breaths per minute, but his coherence is only at 50%. So this resonant frequency is probably this is probably maybe a little too slow for Grafton. So what I'm going to do is I'm going to set it up to 6 breaths per minute and speed it up a little bit and see how his coherence gets. And now you can see the red curved line and the blue curved line are more in phase, meaning they match each other on the ups and downs. And his coherence is at 90%. So that's excellent. So we're getting closer at figuring out the breath rate that's optimal for Grafton. I'm going to increase it to 6.5 breaths per minute. Just go a little faster, see what that does. Just smooth it out a little bit so it doesn't look so jaggedy. I don't see a whole lot of change there. I'm going to bring it back down to 6 breaths per minute. Then I'm going to change the screen to another training screen that's more specific to heart rate variability training. Move the screen over there. Oops. Oopsie. Let's see.
Now I'm gonna need this like all the time in my life. I'm gonna have to like walk around with the screen in front of me, make sure I'm breathing properly.
Well, the good news is the more you practice your diaphragmatic breathing at home at your resonant frequency, the less, you do have changes in your nervous system over time. The nervous system will adapt and make changes, and it will become more automatic. Doesn't mean you will breathe this way all the time, but it means it'll become easier for you to obtain, and you'll have more flexibility in your nervous system and your cardiovascular system.
Neuroplasticity, right?
Yeah, neuroplasticity, exactly. So, this is a resonant frequency that pacer's at the bottom. You'll see 6 breaths per minute. And now, it's the same graph up top, but on the far side of the screen, you'll see a red bar graph, and that is showing Grafton's heart rate variability. So let's talk a little bit about heart rate variability again. So you can see that Grafton's heart rate is going up and down with his respiration. And so his heart rate isn't static. It's changing with each breath that he takes. So his heart rate is varying beat by beat. It's the spontaneous change in heart rate that is happening that causes that heart rate variability. So right now, Grafton's heart rate variability is hovering between 24, 26, which is excellent for someone who's 30 years old. It's just, it's pretty average, pretty great. He's athletic, he meditates, so things look really good here.
Just started meditating 2 days ago.
Great. Well, all your physical health is paying off there too. So now, just for the heck of it, you can see that his respiration and heart rate coherence are not quite together now because he was maybe talking or thinking. And then you notice his heart rate variability went down as well. It went closer to 10 or 12. So right now, Grafton, I want you to think about something that really angers you, upsets you, something maybe stressful interaction you may have had recently, or a concern. And I want you to just spend some time thinking about that right now. So I'm going to pause the screen right here and point out, I don't know if the viewers can see this, it might be kind of hard with our rudimentary video setup, but you'll see that now instead of his heart rate and respiration being in coherence, his heartbeat and heart rate is shifted to the right compared to his respiration. His heart rate is actually, a little bit ahead of his respiration. You can also see that his breathing is a little more jagged, especially at the bottom here. But the heart rate is shifted right, which is a sign of the sympathetic hyperarousal. So
that's so crazy.
You're still exhaling here.
All I have to do is think about something stressful.
And the heart rate says, "Oh, come on." The heart rate starts picking up a little bit and wants to go at a little bit faster pace.
Wow.
Right? So now we're gonna have you do the opposite. I'm gonna push record and have you think about something really pleasant, positive, somebody you love.
Okay.
something new or someone you appreciate.
All right, hopefully that's easier. I rarely try to focus on the negative stuff. It's kind of challenging to like.
Well, that's a
think
good
about.
sign.
Yeah, actually, I guess it comes natural to me though, because I definitely stress myself out pretty easily, didn't I?
Well, at least you're not at risk for being a ruminator.
All right, let's see if I can focus on positive stuff.
Great. So I'm going to pause it there, and we can see his heart rate is actually, his heart rate variability is still great, 17, 18, 19 beats, which is excellent. So his heart rate variability actually went down when he was having a negative experience thought to 11. So immediately by changing his thinking, his heart rate variability improved. And the other thing that improved was the phase. His heart rate and respiration coherence is improved. You can still see, though, without breathing at his resonant frequency. Now, I wasn't measuring his breathing rate, but it may not be his resonant frequency. His sympathetic nervous system is still driving the scene, but he's still in phase. He's much more in phase, whereas before the respiration was, the heart rate was shifted to the right. So there is proof in the pudding that emotions have effect on your cardiovascular health.
So crazy.
That's right. So now, one more time, I'm going to push record, Grafton, and I want you to breathe with the pacer at 6 breaths per minute.
All right. I got a little off track that last time because I was thinking about skiing with my cousin.
Oh.
And then I started thinking about all the crazy stuff that he makes me do.
So that might be why your sympathetic nervous system is a little more activated.
I was like, oh, this is a good thing to think about. And I was like, oh.
You still did great, Grafton.
Okay, so.
Okay, so I'm going to push play. Follow the pacer. Oh, let me get that respiration line back on board there. Get rid of that dotted line.
So think about positive thoughts and go with the pacer?
Or just follow the pacer.
Okay.
Think about positive thoughts. I never stop people thinking from positive thoughts, that's for sure.
Okay.
Okay, so right now you're going to look at that bottom pacer. Great. Wonderful. Look at that. That's excellent. He's in phase, and his heart rate variability is up there.
I felt better too. Like I just felt better breathing at that rate.
Great. So I want to emphasize, everybody has their own heart rate, their resonant frequency. Mine happens to be 5.5. Grafton looks like it's about 6. There's no judgment whether better or worse, high or low. It doesn't matter. It's just individual based on your particular cardiac and respiratory needs. So there you have it.
All right. Thank you.
You're welcome.
All right, so I'm back with Charmaine. We just did the biofeedback session, and boy, that was pretty interesting. Something that she didn't show in the video, but that was really interesting to me was my temperature. My temperature when I started thinking about stressful things.
Skin temperature.
Yeah. Skin temperature. And when I started thinking about the negative thoughts, plummeted. And then when I started thinking about the positive thoughts, started to climb again.
Isn't that fascinating?
Yeah, it's crazy. So it was I've done this twice now with you. Both times I've learned quite a bit about my body and how this can be helpful.
Right.
So
what I'd like to ask Grafton, and I forgot to when he was still hooked up to the biofeedback machine and the sensors, is that I wanted Grafton to talk a little bit about what he felt, either emotionally or physically, what sensations he had in his body during the time when I asked him to think about something that stressed him out or something that was negative. So do you remember what you were feeling?
Just like a heaviness, kind of like just a heaviness, and kind of, I didn't feel like I was just. That's probably the best way I can describe it.
Was it your whole body or certain parts of your body?
Kind of more in like the pit of my stomach
Okay.
and my. I just seemed like I felt more frantic.
Frantic. Okay.
Yeah.
Yeah. Okay. So obviously those are descriptions of things that are not pleasant. Having some kind of heaviness in the pit of your stomach and a frantic feeling. Those are what comes to my mind is someone feeling non-centered and maybe not being mindful,
Mm-hmm.
other than the problems that are running through his head.
Mm-hmm.
So when we switch to thinking about something or someone that you appreciate or someone you love, what did you notice in your body with that?
Levity.
Levity.
Like the opposite of the heaviness,
Did you notice also how when he answered, his whole demeanor changed as well?
Yeah.
So tell me a little bit more about what you felt in your tissues in your body, or maybe in your mind.
I mean, I just felt like it was like a feeling of like fun, like I felt like my body and everything, like I felt it in my whole body that I was like I was enjoying myself.
Yeah. Oh,
and
great.
enjoying life. So,
Uh-huh.
I guess in that sense, like I just felt, yeah, more centered.
Mm-hmm.
Definitely not frantic.
Mm-hmm.
Like I just felt like, in the flow.
In the flow. That's great.
Mm-hmm.
Yeah. Wonderful. So that's those are great insights that you had about your body for just only having biofeedback once or twice.
Well, you're a good teacher.
Thank you. So
So
anything else?
yeah, I wanted to ask you if there's any, like, I guess a lot of people, I think everybody can benefit from biofeedback after doing it. I think I can't think of anybody off the top of my head that just doesn't need it or wouldn't benefit from this at all.
Yeah.
But what, like, I guess in our medical model that we're using, we tend to put out fires instead of preventing them. And you happen to be a part of this medical model as a physical therapist and a biofeedback therapist, and you have spent a lot of time working within the framework of the insurance world and stuff. And I guess in this framework, we tend to put out the fire instead of stopping it and preventing it before it starts. So where I could see where most people would benefit, or almost everybody could benefit, would be in the prevention side, like preventing some kind of pathology, like you were talking about before hitting that critical mass. Like before you get to the critical mass, put out the spark.
Right, right.
But unfortunately, that's not how we always see things in this world, and that's not kind of how what Western medicine is really good at this point. Hopefully, that'll change soon. So, at this point, what patients do you see where you find your service is really helpful at kind of like putting out that fire, like once they do hit a critical mass, and they do have, symptoms that are difficult to deal with and affecting their daily lives? Like, what kinds of patients or clients are you generally working with in that respect?
Right. That's a good question. I think you're right that biofeedback can benefit definitely a lot of people. Just unfortunately, a lot of people don't know biofeedback, what it is, or they just have a general sense of it is, and that's it. They don't understand exactly how it works. So
it's so crazy. Like you just like look into your soul when you look at that screen.
Yeah,
it's
in a
wild.
way, it is crazy, isn't it?
Anyways,
so I think I can tell you the type of people that I who end up in my office are people who a lot of times don't benefit from the traditional physical therapy because they are either hypervigilant in their muscles or in their nervous system. They're dealing with chronic pain, chronic lack of sleep. They've had some kind of family trauma, either in the past or recent. They've either been sexually abused, physically abused, emotionally abused. These people are not really in their own skin. They're not in their own body.
by the time they get to you, they probably haven't responded well, not just to physical therapy, but like traditional medical treatment, drugs, surgery, whatever it is that they've used to try to get better.
That's right.
So they end up at your doorstep.
That's right, because it's an alternative medicine, biofeedback is. And
so they exhaust all the traditional tools, and then they're like, all right, let's try this biofeedback.
That's right. And by that time, they've also been traumatized by the medical field, the medical system, because either they don't know what their diagnosis is, or they do, or there's no cure, or it's a very simple explanation, but in a sense, some of these people are so exhausted, so stressed out. They just don't know where to begin. They need some kind of direction. And telling them, maybe their physician say, "Well, I think you should meditate," or "I think you should exercise." They just don't know where to begin. And so the biofeedback session can help educate these people and ground them so that they have a place, a starting point. And then also have that reflection of the information fed back to them so that they can really get a sense and validation of what they're going through.
Yeah. I think that's really valuable.
All these, so
like mindfulness meditation is great, but you don't get that, like, you don't see what's going on when you're doing it.
Right.
So that's kind of like what I'm trying to do with this experiment, is to like get a sense of what's happening inside of me, and I use some like really I would say relatively compared to what you have here, rudimentary tools, but everybody has access to them, But these tools, you've got access to them; they're really valuable.
Right. Like I said earlier, I think I mentioned the goal of biofeedback is so that people can learn how to do this on their own and be independent of the biofeedback.
Right.
But some of the other things, common conditions that I treat are neck pain. Either it's associated with a motor vehicle accident or just from repetitive strain or sitting at a desk for too long.
I would assume that the motor vehicle accident folks would really benefit from this, especially because it's so traumatic, and it's such a traumatic experience. So they're probably dealing with the psychological and emotional trauma of that as well.
They're stuck in fight or flight a lot of times.
Yeah.
Still.
I mean, have you ever been in a motor vehicle accident?
Not a severe one.
I was in one with my dad when I was like 13, and I remember like getting out of the car and just like shaking.
Yeah.
And just shake, like I couldn't calm myself down. It took like a little while before I was just able to control my faculties again.
Right.
So even right after that, I wasn't right for like a couple of hours, but I'm sure that I wasn't completely right for like a couple of weeks. And if it had been a worse one, we were only going 35, and we hit somebody head on. They were stopped, but we went straight into them.
Wow.
They turned right in front of us and cut my dad off. Anyways, I can imagine if it was a more serious accident, if I was a little bit older and I had to deal with a lot more physical damage from that, that it would be a lot more traumatic, and I'd probably have a tendency to like hold on to that for a while longer.
Right. Well, it sounds like you, because of the circumstances and your age, maybe, and that you weren't seriously injured, that you came out okay. But sometimes these people in car accidents,
I've seen people in the clinic that they have serious trauma.
What happens is when you're stuck in that sympathetic nervous system drive like that, your body and brain thinks there's still a threat. And so you've got certain chemicals pumping through your system, like
always running from a tiger.
That's right. And your body can only sustain that it's not meant to sustain that for a long time. So that's when some problems start to exist. So, I also treat people with migraine. I see a lot of patients with migraine headaches, or cervicogenic headaches, and Raynaud's syndrome, which is with the cold.
You might have a little of that going on.
Cold fingers, and a lot of chronic pain because people with chronic pain also have alterations in a lot of times with their respiration and the way they carry themselves, the way they guard themselves. They really benefit from surface electromyography. And so those are some of the things.
We didn't talk about that too much, but that's basically like you put an EMG,
sensors on
their surface EMG, and then you have them try to relax certain muscles,
correct,
right? Or basically gain voluntary control over certain muscles that are maybe too ramped up. And you're talking about like muscle spindles, and muscle spindles are basically they control the tension in your muscles, right? Like, or they tell your muscles when I'm gonna butcher this, but they tell your muscles when to contract and protect, and when to relax. And so
Basically,
different lengths or different lengths of the muscle spindles.
Right.
It's involved in proprioception too, like knowing where your limbs are in space. But those are actually controlled largely by the sympathetic nervous system, which I wasn't really aware of.
Yeah.
And so if you decrease sympathetic tone,
well, essentially a trigger point is a muscle spindle or spindles that are activated and stay activated.
Okay. So trigger point is like when you feel like a knot in your muscle.
Right.
Then that's muscle spindles that are activated and stay activated.
And they're activated, and there's what am I trying to say here? It's triggered by the autonomic, sympathetic nervous system.
Yeah. So you have a lot of sympathetic output.
Right. If you
those
have
muscle spindles are gonna trigger a trigger point.
And that's right, and cause pain.
Right. So if you can gain control of that, then you can like relax that.
That's right. Just by breathing. And again, it always comes back down to the breathing and body awareness and things like that. So.
Right. I mean, I'm sure like trigger points and knots in muscles that cause pain. That's like a really general experience that people have. You know, like sitting at the desk,
I'm sure.
stressed out.
Who do you know who hasn't had one?
Yeah. So okay, that's really good. So, anything else that you would like to say about biofeedback or what you do, or the name of this place is
Charmaine Rhine Biofeedback.
Charmaine Rhine Biofeedback and Wellness Coaching.
Yep.
And I'll put a link to your website on the video. So
sounds great.
If people are watching, they can check you out, and if they're in the Grass Valley or Nevada City area and you're struggling with, I mean, honestly, I think everybody should come for a session or two. But especially if you're struggling.
That'll keep me busy.
Yeah. Treating everybody in town.
There'll be a line down the curb.
Especially if you're struggling with one of those problems that you mentioned earlier. You should definitely get in here and check out Charmaine's methods, because they're really useful.
Yeah.
So.
Well, thanks for talking with me, Grant.
Thanks so much for your time. That was an awesome experience.
Yeah, you're welcome.
Very generous of you to kind of share.
Oh, my pleasure.
All right.
Yeah.